Triglycerides, the hidden danger to your heart health. Triglycerides might be the hidden enemy lurking within your body, silently damaging your heart health. These tiny fats might seem insignificant, but when they accumulate in your bloodstream, they can create a major problem for your health. If you're not aware of triglycerides, you might be putting your heart at risk without even knowing it. But worry not. This video is going to be your guide to everything you need to know about triglycerides. Stay up to date with the latest health information by subscribing to our channel and hitting that notification bell. Your health will thank you. The rise of high triglyceride levels has been creeping up on us like a silent assassin, slowly but steadily making its way into our lives. In recent years, this sneaky foe has been gaining more and more ground, leaving millions of people worldwide at risk for heart disease, stroke, and other major health issues. But why are triglycerides so dangerous? And how can we protect ourselves from their harmful effects? This video will answer these questions, so stay tuned. When it comes to triglyceride levels, it's all about finding that sweet spot between too low and too high. But what exactly is the sweet spot? And how can you know if your levels are normal? Well, for men, the magic number is below 150 milligrams per deciliter, while for women, it's below 135 milligrams per deciliter. These might sound like just numbers, but they're actually critical indicators of your heart health. If your levels fall within this range, you're in good shape. But if they're too high, you're at risk for some serious health problems. When it comes to heart health, it's not just about one type of cholesterol, but rather the delicate balance between different types. And when triglycerides come into play, this balance can be thrown off kilter. If your triglyceride levels are high, your levels of good cholesterol, HDL, are often low, putting you at an increased risk for heart disease. But that's not all. High levels of bad cholesterol, LDL, can also team up with triglycerides to form a dangerous duo, contributing to the buildup of plaque in your arteries and increasing your risk for heart disease. Did you know that high levels of triglycerides can be a ticking time bomb for your health? While heart disease is the most commonly known risk associated with high triglyceride levels, it's far from the only one. In fact, research has shown that elevated triglycerides can significantly increase your risk for a number of other serious health conditions, including pancreatitis, a painful inflammation of the pancreas, diabetes, a chronic condition that affects your body's ability to regulate blood sugar, and metabolic syndrome, a cluster of conditions that includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Elevated triglyceride levels can be influenced by various factors. Certain medical conditions, such as obesity, diabetes, and hypothyroidism, can lead to increased levels of triglycerides. Obesity is particularly significant, as excess weight can increase insulin resistance and promote the accumulation of triglycerides in fat cells. Certain foods are also known to be high in triglycerides, especially those high in sugar and refined carbohydrates, such as cakes, cookies, and sugary drinks. These foods are rapidly converted into glucose by the liver, which can result in increased levels of triglycerides in the blood. Habits like smoking and excessive alcohol consumption can also contribute to high triglyceride levels. Smoking increases oxidative stress in the body, which can cause inflammation and damage to blood vessels, while alcohol can cause the liver to produce more triglycerides, leading to elevated levels in the blood. It's important to note that while certain factors can contribute to high triglyceride levels, making changes to your diet and lifestyle can help reduce them and improve your overall health. Triglycerides can be a tricky problem to tackle, but the good news is that there are plenty of effective ways to decrease their value. Non-pharmacological management, without using drugs. One of the most important steps you can take is to adopt a healthy, balanced diet that is low in sugar and refined carbohydrates. This means steering clear of foods like candy, sugary drinks, and white bread, and instead opting for whole grains, fruits, and vegetables. In addition to a healthy diet, regular exercise is also key to reducing triglyceride levels. Whether it's a brisk walk or a jog around the park, getting your heart rate up can help to burn off excess triglycerides and improve your overall heart health. One study published in the journal Circulation found that regular aerobic exercise can lead to a 20 to 30% reduction in triglyceride levels. Studies have found that a diet high in omega-3 fatty acids, which can be found in fatty fish like salmon, can significantly reduce triglyceride levels. One study published in the Journal of the American Medical Association found that consuming 2 to 3 servings of fatty fish per week led to a 30% reduction in triglyceride levels. In addition, incorporating nuts, especially almonds, into your diet has also been shown to help lower triglyceride levels. A study published in the Journal of Nutrition found that participants who consumed almonds daily for 6 weeks saw a 10% reduction in their triglyceride levels. Pharmacological management, with the use of drugs. Fibrates and statins are two types of medications that can be used to lower triglyceride levels. Fibrates work by reducing the production of triglycerides in the liver and increasing the breakdown of triglycerides in the blood. Statins, on the other hand, work by reducing the amount of LDL cholesterol in the blood, which in turn can lead to a reduction in triglyceride levels. Several studies have shown the effectiveness of fibrates and statins in lowering triglyceride levels and reducing the risk of heart disease. For example, a study published in the New England Journal of Medicine found that treatment with the fibrate medication gemfibrozil reduced the risk of heart disease in patients with high triglyceride levels. Another study published in the journal Circulation found that treatment with the statin medication atorvastatin reduced triglyceride levels and improved other lipid markers in patients with metabolic syndrome. Overall, medication should be considered as a treatment option for high triglyceride levels only after lifestyle modifications such as diet and exercise have been attempted and found to be inadequate. It is important to discuss the potential benefits and risks of medication use with a healthcare provider. Triglycerides may be a hidden danger to your heart health, but now that you know more about them, you can take steps to keep them in check. By making some simple changes to your lifestyle and diet, you can lower your triglyceride levels and reduce your risk of heart disease, stroke, and other serious health problems. So why wait? Start taking control of your health today and talk to your healthcare provider about how you can improve your triglyceride levels. Remember, prevention is always better than cure. Thanks for watching.